Power Talks, empowering you through the voice of truth with your host, Dr. Joel Hunter.
Hi, I'm Dr. Joel Hunter, host of Power Talks, empowering you through the voice of truth. On today's program, we will be talking about practical responses to drug abuse. Our panelists are Michelle Smith, Lieutenant Michelle Smith, who has been the Emergency Management Coordinator at Seminole County Sheriff's Department, and Bob Cortez is Senior Administrator of Governmental and Community Affairs and has been a state legislator of ours in the Seminole County Sheriff's Office. These two are both connected to Seminole County because our new Attorney General, Ashley Moody, has designated our county sheriff, Dennis Lima, as kind of the lead organizer for the state's response, and so we're kind of getting in this particular county a head start on trying to respond to this very significant crisis. I think the figures are that if you die and you're under 50, opioid death is death by overdose is the leading cause in the nation of people who are under 50.
That's correct.
So Michelle, let's start with you. You have been the emergency management or manager for emergency operations. Now you're kind of you're assigned to this task.
I am.
What are the components you have to put together in order to, I know when we meet at the Emergency
Operations
Center,
We
that's
do.
it. Yeah. So what are the different components that you have to put together in order to have a comprehensive response?
So right around Christmas, myself and Lieutenant Rachel Rados got a phone call asking if we wanted to assist on the opioid task force and start looking at what other people are doing around the country, best practices. So we started researching that a little after Christmas and seeing what was going on across the country. And then we were asked to put together recommendations for Attorney General Ashley Moody. We had recommendations from all across the state of Florida, and Lieutenant Rados, who has her doctorate degree, put together a document, sent it up to the state. So while all that was going on, we were also looking, what can we do here in Seminole County to really make a difference? And we came up with, we've got a lot going on. We're really busy, and one of the things that we took from another agency was, it's called the ANGEL program. So here in Seminole County, whenever there's an overdose, law enforcement and fire department respond. Usually they are transported to the hospital. We now send a deputy to the hospital and try to talk to the person who's overdosed and try to talk them into treatment. And we've had great responses, and we've probably got about 6 people into treatment right now, which is better than what we were doing last year.
Yeah.
So that is one of the things we're doing. We also have an opioid council, which is made up of community partners from law enforcement, the school board, the military. We have parents, we have mental health and substance abuse counselors,
The faith community.
of course, the faith-based community. And everybody is working together on a 3-pronged approach. We're working on prevention, treatment and recovery, and enforcement.
Okay.
So
That's
just some of the things we're doing in Seminole County.
That's fantastic. Bob, we talked in the room about a couple of things. First of all, the importance of intervention for folks who have overdosed. I think the sheriff has said the leading indicator of death by overdose is survival of overdose, because the pattern doesn't get interrupted. And you told us about a couple of cases that were just here recently. Can you? I'll tell you what. Let's go from the big to the grand to the granular. What kind of public policy? You've been in a state legislature. What type of public policy do we need in order to better address this epidemic of opioid overdose?
Absolutely. And Pastor, the legislature has been working on this year after year. I was in the legislature the past 2 years where we passed comprehensive opioid reform. Exactly last year we did House Bill 21, which is the one that limited the prescription of oxycodone to a 5-day or 7-day if it's medically necessary. In the efforts, and then before that we established a PDMP where now every patient has to be registered that is given opioids to the PDMP to make sure they're not doctor shopping. So the legislature is doing on a broad level some stuff. But here's the problem with that, is that you can only address big statewide issues when you do legislation. Where the road hits the pavement, the tire hits the pavement, is what we do on the local level. The stuff that Seminole County is doing here, where you can have intervention programs. For example, what Michelle mentioned is that the person that goes to the hospital when the person has overdosed to seek intervention, prior to that, that person would return right back to the street, right back to the same place they just overdosed from to get some more. So now you're doing some interruption of that in the hopes of stopping the next overdose. So local level is extremely important. On the legislative portion, obviously, the legislature looked at what the practices that were done nationwide. One good example was the Good Samaritan Law. Good Samaritan Law, it was passed in many states throughout the nation to make sure that if you were, let's say you had several people at a drug house and they were all doing drugs and one overdose, that one of those persons in that house could call 911 and not face prosecution.
Yeah.
Because the idea was to save a life.
Yeah.
We had a case in Lakeland where the daughter was overdosing. The mother put in a tub with ice, 6 hours. She died 6 hours later. She was afraid that if she called the police, that she would get arrested. Unfortunately, the daughter lost her life. Now the mother is facing second-degree manslaughter.
Yeah.
So all these things are extremely important.
Yeah.
Statewide, that the legislature continues to work and recognize that the opioid epidemic is real.
Yeah.
17 people are dying each day.
Let me ask about this. This is such it seems like it's come so suddenly. We've always had a problem with drug abuse. We've always had problems with, Michelle, what's unique about this particular crisis that we haven't faced before?
Well, I think it's interesting to note that a lot of people, myself included, prior to really doing research about this, I really thought this was a choice that people made. They chose to get messed up in drugs. And really what the research is showing is these are good people that may have gotten a prescription from their doctor. They are taking the prescription as prescribed, and they're just getting hooked. Yeah. And that's just something different we have not faced before. That's just the properties of this drug are so addictive. Yeah. And there are some good uses for opioids. Yeah. But we really want to encourage people, talk to your doctor if you're being prescribed opioids. Become educated. Yeah. You may not need to take it quite as long as prescribed. Just listen to your body. And so that's just something different we haven't faced. Most people listen to their doctor and do what they're told to do. And this is just a different beast.
Well, yeah, and I think it's to that point. Big Pharma has, has undersold the danger of these drugs. Right. Doctors, giving them the benefit of the doubt, weren't aware of the addictive qualities of the drugs, and so they just overprescribed. And there's very few people who, in the last 5 years, if they got a prescription of oxycodone or OxyContin or one of these other opioid drugs, hasn't got a whole vial of them in their medicine cabinet because they weren't known to be as dangerous as they really are.
Over a toothache, by the way. Remember, this is you went to the dentist and you can get a whole vial of this stuff over a toothache. So, and this is to your original question. What has changed in the past few decades? Back in 1999, Jeb Bush established the Office of Drug Control and things to curb what was happening back then. But back then we had a different type of drug. It was crack cocaine and some other stuff. And it was more of the addicts that were getting hooked on heroin, crack, and all the other stuff. What has changed now is that the opioids have been overprescribed and overtaken, and once a person gets hooked, now if that pill is not taking care of the pain, they're now moving into higher, more drugs that are either heroin. Meth is a big thing. You have so many young people getting hooked on meth. So the synthetic type of creation of the drugs is also contributing to a lot of this. And now it's coming from all ways. We're overwhelmed, and now we're trying to, grab it back into control. The governor did reestablish the Office of Drug Control in executive order a couple of weeks ago.
And if I could just address, when you're talking about everyone has the big vials of it, that's also an important problem. We really encourage people, pitch your pills. When you're done with your prescription, there are drop boxes at all Seminole County Sheriff's Office buildings. All local law enforcement also have drop boxes. So pitch your pills when you're done with them. If you're still using them, lock them up. We're finding the kids are going into their grandparents' medicine cabinets and using them or selling them. So. No need to keep it around.
Part of the spread of this is, and I love that the legislature has now addressed, there are limits to the prescription, 5-7 days, but the downside of that is now when you're cut off and you are addicted, you go to the streets where you're trying to get the same kind of relief, and you don't know what you're getting, and that's where the overdoses come from.
And now you're having heroin being laced with fentanyl and carfentanil, which is extremely potent and dangerous, and you don't know where this is coming from. We just had Volusia County they went and arrested two drug dealers for the death of a person that they sold drugs to. So now the enforcement part, what Michelle was talking about, is not just go against the user per se. The user is somewhat of a victim here. It's going against the person that's supplying that deadly drug to the user and charging them.
Yeah, we're not going to arrest our way out of this epidemic, but we are not going to turn a blind eye to people who are selling fentanyl and heroin and killing people.
Well, so if you would speak to, there are people who I'm sure are listening and they're just saying, and they've never had an addict in their family or even an alcoholic maybe, and they're just saying, why don't people just quit? Because it's just killing them, Why can't they just say no? How can you speak to the dynamic in the brain that kind of takes the typical objective moral is probably not the right word because we have somehow stigmatized this into a moral decision, but that's quite the point. It's not a moral decision. It's hardly a decision at all.
It's not, and the opiates really change the brain chemistry. And I think anybody who's ever struggled with even just sugar addiction or alcohol.
Now you're getting personal.
Yeah, no, but I mean, addiction is no matter what beast or fat you're battling, it's hard for everybody. But opiates is a whole nother addiction. It really changes the brain chemistry and how your brain talks to itself.
And it transcends cultural, social, economic, everything, because at the point, you got to remember, the reason that most of the folks are taking these pills is because they are in pain. And if you've ever been in pain, have a migraine headache, I know I suffer from migraines, you want it gone. So you take the pill and the pill takes it away, great. But what happens 8 hours later when the pill effect goes away? You've got the pain coming back. So we've seen cases where people don't want to go into treatment because they fear that if they don't have the opioids, the pills to take care of their pain, now they're off the addiction, but the pain is still there. So we've seen Representative Plakin has a bill now in the legislature that is giving alternatives to non-opioid alternatives for treatment for pain.
Let's talk about that because we talked about that in our last meeting. It's really interesting. What are some of those alternatives that are not, opioid based?
Acupuncture. You have chiropractors. You have all the other. You have non-opioid pills, your Tylenol, acetaminophen, and some other combination of that they can give that are not as addictive, but yet do treat the pain. Physical therapy is another one that does this. So what the bill does is very simple. It instructs the Department of Health to come up with a pamphlet that describes all the non-opioid alternatives to give to the patient and let the patient make their informed decision whether they want to have any opioids. And this is especially important for those that were addicted at one time and are off. You know, you don't want to fall off the wagon and by just taking one pill.
Even looking into things like nutrition and yoga and some other holistic approaches. You know, here in this country, we're so used to, if there's any type of pain whatsoever, we take a pill to be gone. But you're finding in countries across the world, you know, they don't have that same mentality as we, like they're used to a little bit of pain, and we just need to change the mindset of people.
Pain management,
not
instead of pain elimination or relief.
That's right.
Yeah, and that's pretty much life. Pain management.
Right.
It's just, we've got to manage rather than just trying to immediately eliminate it.
Exactly. And, you know, this is where our sheriff has done a phenomenal job. Sheriff Lima has come in completely and made this his #1 mission this year in this office because of what we've seen, how it's affecting the families here in Seminole County. He has made it a point to not just educate himself, educate everybody surrounding him about how bad this is and how we are going to take the lead into fixing it. I got to commend the sheriff for doing a great job.
Absolutely.
Huge fan of Sheriff Lehman. Tell us about the diversion programs that you talked about, Bob, the likelihood if someone just receives treatment or they're brought back from an overdose. By the way, how many last year were brought back from overdoses? You got that number? It's 400 something?
It was total of 253, I think, is what we did with the deployment in Narcan. Now, the whole deployments were close to 500, 600, because some of them were given more than once.
I got you.
And we're at 122 overdoses so far this year, 22 of which have been fatal.
Okay, okay.
82 died last year. Just to put it in perspective, 82 died of overdoses. Between car crashes and homicides in Seminole County, it was about half of that.
So how do you break that pattern? You know, once you in any kind of addiction, you don't even want to break the pattern. You just want to keep going. But there is this other voice that says, "This is bad for my family. This is bad for me. I don't want to be in bond." So you say you go to the emergency rooms. You try to talk them into another avenue. Tell us about that.
Well, first, we want to prevent anybody from starting to begin with. So prevention is really a big part of what we're trying to do, get some messaging out. We're doing a lot of programs in the schools to really prevent people from even starting that. So eventually, hopefully this problem will go away. But the ones that are still currently facing addiction, yes, we are going to the hospitals, trying to get them into treatment. We are forming really good partnerships with Advent Health and Aspire and a lot of our treatment providers trying to get people into treatment. Right now, we do have some issues with bed space. We probably need a little bit more funding from the legislature, possibly have some more treatment facilities for long-term. Not everybody is going to need long-term inpatient treatment, but it's definitely needed. So we're working on that. We are working here in Seminole County. One of our lofty goals is to open our own treatment facility. And like I said, we've partnered with Advent and Aspire, and we're really trying to have a one-stop shopping where, you know, if you've got a family member that's struggling, you can bring them to Seminole County, and we will work on trying to find treatment for them. So we're working on that.
And on the legislature's front, so one of the things that the governor just announced a couple of weeks ago is the creation by executive order of an opioid task force, a statewide opioid task force comprised of the chair's General Moody. Ashley Moody is the chair, and 21 members that's going to be appointed by both the governor and the attorney general. So that is being created right now, and the goal is to bring out some of the stuff that we've already recommended and try to seek treatment, but there's also $26 million coming for the federal government that's going to be assigned to the task force to assign to programs. So the hopes is some of that funding does come to the local level where we can have more beds, more facilities, more treatment available, education. I cannot stress how important it is to educate everybody. The parent that has a son or a daughter that is addicted either does not know about it, or if he does know about it, does not want to talk about it. And that,
Let's stick
unfortunately,
there. Let's stick there. Let's say that a parent discovers that their son or daughter is using. They're scared to death. You know, they don't want to, you know, shame this kid into running away. They don't want to. They're not naive enough to think it's just going to go away. What do they do? Do you have any suggestions on what a parent does?
I can tell you what's happening right now, which is part of the problem. They go and seek treatment, and they're finding there's not enough beds available. That if they are, it's a waiting list to get into the bed, and they're being turned away, and the child or the young adult is coming back to the same environment that they're there. And then there's a lot of other issues that pop up, you know, issues of trust. Now, you know, do you trust your son or daughter that is going to go out on the street and not going to get a fix? Because now you've got in your mind that he or she might be addicted. So it's a terrible situation to be in.
There are some people that are lucky that have good insurance and insurance will cover treatment, but unfortunately a lot of our population is either uninsured or underinsured and are not able to afford. A lot of the treatment programs that are available are just a little pricey, and not everybody's going to have the ability.
What about those who are using, they want to get off, they say, I can't afford treatment. The reason I'm out on the streets is because I can't, you know, I'm looking for cheap drugs and I'm putting my life in danger and so on and so forth. Can they call like Aspire, or can they call the local 12-step group, or what, you know, I mean, how could they do this in the healthiest manner to at least inquire what is available for somebody like me?
Well, first of all, I think also one big important factor is faith, you know, the faith base. We all, when we're in trouble, we always seek God. You know, we go to our pastor and we say, listen, my son and my daughter's having problems. I don't know where to turn to. Can you talk to him or her? So I think that is one that doesn't cost anything, and you can seek that immediately. And then you have Aspire and others.
And let me intervene here. Many churches and other religious institutions have recovery groups in their congregation. It's just part of their congregation. So, and if they don't have them, they can refer you to another, you know, faith-based recovery group that really gives you the community that's important to pull out of this, because the stigmatism and just the natural withdrawal of someone who's addicted leaves them even more vulnerable to that repetitive pattern. So thank you for bringing that up. Go ahead.
Absolutely. And the Department of Health does have on their website several options that you can look up on treatment recovery centers. Like Michelle said, unfortunately, a lot of them, because this is so widespread, are either on waiting lists or they don't have enough beds. Those who have insurance can go to a private facility. And we are continuing to work with the partners. Michelle can talk to you more about that, about how we can expand this, at least in Seminole County. And the hope is what we do in Seminole County makes a big difference, and it can be replicated statewide.
Great. Yeah. You got any other suggestions for people who are really trying to seek help, but they've got no money?
Well, Aspire is the healthcare provider for Seminole County, so work with them. There are some situations where we may be able to Baker Act someone if they really are not in control of their faculties. And but no, that's definitely what we struggle with the most is finding bed space for people. But again, not everybody's going to need inpatient treatment. There are plenty of licensed mental health and substance abuse counselors in Seminole County. You can even go to the SAMHSA website. You put in your zip code, and they can tell you all the treatment providers.
SAMHSA stands for?
Substance Abuse Mental Health Administration.
Okay, all right, very good.
If I can go back to the question you asked before about the diversion programs. So we really do have some great things going on here in Seminole County. We've got a drug court that's been going on for several years that we've had quite a lot of success with. We also have a new program that we're really proud of here. Our jail has turned in one of our pods, we call it OPOD, into if somebody has been arrested and they're already in jail, but we know that they're struggling with substance abuse, They are now transferred over to the O-Pod, and we're doing treatment in there. We've got Vivitrol, which is a medical treatment program that they can be on. We're bringing in faith-based partners. We're doing the yoga. We're doing nutrition. We're doing a little bit of everything. Now, some people are only in there for a few weeks. Some people are in there up to 364 days. But we're trying to work, and when they are ready to leave, we're trying to transition them into treatment outside. We have a case manager who is trying to make sure they don't go back to the same house that they're in that they've had problems with. So we're really trying to do an all-encompassing approach.
Good.
So we're really proud of that.
Well, it's fantastic. And it's fantastic to be able to say, look, this isn't about good people and bad people. No. This is about sick people getting better.
Correct.
And to take away, as I said, the stigma that this has stands as an obstacle to both admission that I've got a problem and to the kind of treatment community that I need.
And it goes along the hands of reduction in crime. Yeah. Because if you have an addict that is shoplifting or is burglarizing, he or she is doing that to feed the addiction, to go and buy drugs. So you try to get those folks off the addiction, you're going to get them off the burglarizing too. So I mean, that's the whole. It's a general picture that would solve several things at once.
And one thing we're trying to do to work on destigmatizing it, so people are willing to come forward and ask for help and know that they're not going to be judged. Is unfortunately we have a fabulous group of parents that have lost their children to the opioid crisis. So they really are coming together. We're kind of coming up with some great ideas on things that they can do, not only to honor their children, but to get the story out so people are also willing to share their story. So we really are trying to do some great things in Seminole County.
Well, you guys are heroes. You're really doing great work in a focused way that's going to be so helpful, not just for this county, but for the rest of the state. So thank you for what you're doing. We are out of time. I hate this.
Thank you for having us.
Oh, man, I want to thank Michelle and Bob. They are just such great leaders in our community. And I want you to remember that these discussions are just that. They're discussions among us. We'd love to see you continue the discussions at home, though, and go one step further. Get involved, because when power talks, you are empowered through the voice of truth. See you next time.
You just watched Power Talks, a Good Life 45 original production that makes you part of our Hope Team here on Good Life 45, where hope happens.